Guys, we are with Sabrina. She's in the second year studying English with us, and today she's going to make a presentation about dentistry, all right? She's studying dentistry in the university in Pernambuco. So today I'm not going to be the teacher. I am going to be the student. So enjoy the video. It's recording.
Okay. So, I'm Sabrina, and I'm a dentistry student, and today I'm gonna talk about my dentistry journal and talk about some curiosities and things about the course. First, I wanna talk about why I chose my course. So, why did I choose dentistry? When I was in my process to choose my career, I didn't know what I would like to do in my life. But I had some idea in my mind what I would do. And I looked for something, some career that I could help someone transform lives, feel happy, share joy with other people, and of course make money. Everybody works and wants to receive money. And I started to prayed a lot, and I asked God for some directions, for some directions to help my choose.
My decision.
Decision, yes. And I prayed several times, and I said, God, please show me the way, show me the profession. And God directed me, and I decided to start my journal on this way. And on February 5th, in 2019, I started my course at University of Pernambuco. This is me.
Okay, I know.
So, let's talk about dentistry. What is dentistry? Do you want to know something about the dentistry?
Okay, dentistry is the science which study everything related to teeth and the bones in our mouth.
Yes, congratulations. You know more than I knew when I started. So, the dentistry is the science, as you say, that is about the stomatogenic system. Stomatogenic, do you know what is?
No, I have no idea.
Stomatogenic system is the system responsible for our speech, chewing, swallowing, suction, and breathing. Breathing is not the principle, but it's also involved. And the stomatogenic system involves the temporomandibular joints, the soft tissue, there are gingiva, mucosa, tongue, checks, lips and glands. It involves bones forming the oral cavity, the skull's bones, and teeth, and muscles involved in chewing and swallowing.
Muscles. And chewing.
Muscles. Not CL, muscles.
Muscle.
Okay, thank you. So this is the stomatology system.
Wow.
It's really cool. And some curiosities about the period at university. So at university, the students has to study the principal specialties to be able to do the general procedures. We have to study everything, and we have to study everything. But at university, there are some specialties that we don't study. We have to do other specialties. But the base of dentistry we have to study. Okay?
Mm-hmm.
You can correct me when I make a mistake.
For sure.
So the quiz takes 5 minutes to get bachelor's in a public university, but there are some private universities that it takes only 4 years. I don't know how, because there is many things to study, but okay. And the students learns the procedures. I hate this word because every time I forget. Sorry. In the laboratory first and after does in the patient. So we do in a dummy and after we do in patient. Okay, but there are some things that we don't learn in dummy first. We learn in the patient. It's crazy, but it's everything supervised by the teacher. So don't.
Those patients, do they pay for the service or is for free?
It's for free.
Okay, so yeah. They are rabbits or mouse or laboratory, right? So
yes.
They are taking some risks.
Mm-hmm.
All right.
And we do everything by Swiss.
Okay.
Because my university is a estadual university.
Okay.
But I believe that in private university is free too. Also free.
Okay.
And after the degree, the dentist can do a hospital residence. Okay. Hospital residence, specialization, masters, and doctorate. Okay. And I'm gonna talk about the dental specialties. This is Elena. She was my first patient, and she was my first roommate when I lived in another house.
Okay, so you live with her?
Yes.
Cool.
Yes, she was my first patient. I love her, She's really, really special in my life.
Okay, cool.
This is a dog, not a dog, but a model.
Yeah, model.
And we do everything. We learn first in the laboratory, and then we go to the clinic. So, according to Federal Board of Dentistry, there are 23 dental specialties in Brazil. It's many things.
Yeah, I didn't know that.
It's really cool. You will see. So, I'm gonna talk a little about each specialties.
Okay.
There is temporomandibular dysfunction and oral facial pain specialty, and it treats pain in a temporomandibular joint. Do you know what is?
Yeah.
Okay. The dentistics is the aesthetic area, and also do the restorations, the teeth restorations. Oral maxillofacial surgery and traumatology. They study about the trauma and the bones, and also lism, L-A-L-E-S-O-N.
Lesson.
No, lesson.
L-E.
No, can't just say.
Use the marker. Yeah. L-E. Lesson.
Okay, thank you. Lesson, because we can't treat malignant lesion, just benign lesion.
You mean cancer?
Yes.
Okay.
Cancer we can remove, just the doctor. But when the lesion, when is a benign lesion, we can remove. And the trauma, and to remove the teeth. Alright?
Okay.
Dental radiology and imaginology. You know what this is.
Okay.
And the don't is the area that treat infections in pulp. Pulp is the middle of the teeth, and root canal treatment, as the people know.
Yeah. It's a complex surgery, right?
Yes, I hate. It's really small, and you have to have precision, and you can't see anything, so it's difficult.
Wow.
Yeah. And if the person don't treat, they can have another bigger problems. So stomatology is the area that the professional, they do a clinic analysis of all lesions on the mouth. in the mouth. For example, verbal, cankerous, yeah? And they work together with the pathologist, because they do the clinic analysis and the pathologist do the molecular analysis.
Wow.
For example, I don't know, but imagine this lesion is a malignant lesion. So I take off.
I take an example.
I take an example of biopsy, and I send to pathologist, and the pathologist will do the molecular analysis and send me the answer,
The result.
the diagnostic. It's very cool. Orofacial harmonization is the other aesthetic area, and it corrects some regulations in the face. Homeopath, they use natural things to treat, and dentistry implant restore our lost teeth. Yeah. Geriatric dentistry work with elderly. Pediatric dentistry work with children. Dentistry for patients with special needs work with people with some needs. For example, people with syndromes, Down syndrome, and things like that. There is also sport dentistry. There is work dentistry, legal dentistry, that they can identify disease by the dental art, and many things. Collective health, that is it's not a dentistry area. It's a person that study the community, and they study how can improve the health for these people. This is collective health. Orthodontics and functional jaw orthopedics treat the bite, but orthodontics is to young and adult people, and orthopedics is to children. Dental prosthesis, acupuncture treats pain. It is a Chinese medicine.
I've done acupuncture.
Yeah?
Yeah, it's very nice.
And how was the experience?
So, the first time I went there, they put a needle in your head in a specific point to relax you.
Yes.
You feel good, and then they put a lot of needles in your body, and sometimes they induce electricity in the needles. So it treats a lot of medical problems.
Yes, it's really interesting.
Yeah?
Why did you do acupuncture?
I was with depression.
Depression,
Yeah, I
yes.
had depression, so acupuncture helped me.
Anxiety.
No, not anxiety, but I was with depression. I had some existential disappointments, and for a while I didn't want to live, so My mom took me to acupuncture and it helped me a lot.
Yes, it's really good.
Mm-hmm.
We used to excited too because there are many people that don't like to see a dentist, and it's really too relax. And periodontics treats the infection in a gingiva.
Mm-hmm.
And maxillofacial.
How do you say gengiva in English?
Gingiva.
Gengiva? Gengiva. Gengiva, okay, cool, gengiva.
And maxillofacial prosthesis. We can make eye prosthesis, nose, everything in the face. We can make a prosthesis. And the last things about dentistry that I only discovered at university. The dentist anatomic area of work is the nasum that is here, to oid bone that is here,
Okay.
and tragus to tragus. You know what is tragus?
No, I don't.
It's this.
Okay.
Tragus to tragus. So we can work here to here to here to here.
Okay.
The dentist can prescribe medicine. We can, as a doctor, we can do, but we only can prescribe medicine that
Is related to?
is related to the procedures.
Okay. Like analgesics.
It's antibiotics, things like that.
Okay, cool.
It's really cool. And dentists can know about your habits, diet, and oral hygiene routine just by looking at your teeth. So even if the person don't say, the dentist can know the habits of this person. For example, if the person smokes, if they drink a lot, yes, if they are diabetics, diabetes, yeah.
Wow.
For example, in the pediatric dentistry, we can identify if the child suffer sexual abuse. Okay, dentist can be a hospital surgeon, as I told you. And the last is oral hygiene is toothbrush, toothpaste, and floss. Because I know many people that don't use floss, but floss is very important.
Okay.
Thanks.
Wow.
Do you have any questions?
Yes, I do. What specialization would you like to do?
I would like to do dentists, and I don't know, but I like periodontics.
Okay.
But I have many things to see yet. So I don't know, it can change.
Alright. That's it, guys. This was the presentation of Sabrina. If you like this video, hit the like and see you soon.